Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Relief as the NCDC data shows the country records no deaths for over a week, resulting from COVID-19 complications. Worries in Yobe State as tuberculosis patients stay away from hospitals due to anxiety over symptoms similar to COVID-19. And India, world's largest producer of vaccines, runs short of coronavirus vaccines. Between the 7th and 20th of April 2021, Nigeria recorded 1,035 cases, a figure it used to record on a daily basis at the beginning of the second wave, which was announced in December by the Presidential Task Force on COVID-19. In the meantime, even though the cases this week have varied, with the latest confirmed cases recorded last night at 120, our infection rate on a 7-day average is 73. But the good news is that the death toll is unchanged.
Since the last 24 hours, there's been an increase in the number of active cases being managed across Nigeria. According to data by the Nigeria Center for Disease Control, NCDC, there are 7,956 active cases in the country, increased by 98 from the 7,858 active cases recorded in the previous 24-hour cycle. The agency has confirmed 122 new infections reported from last night, a rise from yesterday's daily count of 70 new confirmed cases. The latest figure was reported from 8 states, with Enugu taking the lead with 53 cases, followed by Lagos, the epicenter of the disease, with 22 cases, while Rivers has a record of 18 additional cases. Other states include Ogun with 8, FCT with 7, Abia with 6, Kano with 5, and Bauchi with 1. With the latest tally, Nigeria has recorded a total of 164,423 infections as of April 20th, 2021. The fatality rate in Nigeria appears to be declining as no new COVID-19 related deaths were recorded, again in the last 24-hour cycle, the third time in a row since the beginning of the week. This leaves the fatality toll in Nigeria at 2,061. According to the NCDC, 22 persons were discharged last night after testing negative to the COVID-19 virus, raising the total number of recoveries to 154,406. About 55.4% of Nigeria's target population have been vaccinated with the Oxford AstraZeneca vaccine. This is according to data by the National Primary Healthcare Development Agency as at 20th of April. At an inaugural town hall meeting of the North Central Zone organized by the Presidential Steering Committee in collaboration with the National Primary Healthcare Development Agency in Lafia, the Nasarawa State capital, the Minister of Health states the federal government's plan to achieve herd immunity.
Our target is to vaccinate at least 70% of the eligible population of Nigeria over a 2-year period.
Globally, over 143 million cases have been recorded and more than 3 million deaths.
In Lagos State, the Governor Babajide Sanwo-Olu has launched the Lagos Cares Initiative targeted at alleviating the burden of the coronavirus pandemic on Lagos residents. Governor Sanwo-Olu says the program is a COVID-19 action, recovery and economic stimulus one that will address food security and health management in the state. The intervention scheme will last for a period of 24 months and directly support over 20,000 households and indirect households of over 125,000 individuals in Lagos.
I'm delighted to launch the Nigerian COVID-19 Action, Recovery and Economic Stimulus, which we'll call the NCARES, Nigeria Then Cares, COVID Action, Recovery and Economic Stimulus, a program for resolve in Lagos State. It's a national program, it's an international program, but it's being domesticated at the subnational level. This NCARE program is an integral part of the national approach, like I said, adopted to alleviate the burden of COVID-19 pandemic and enhance the well-being of our citizens. The Lagos State CARES program will be implemented between the years 2021 to the year 2023. and it will provide an economic relief and a recovery support to identify vulnerable persons in our community. The program will directly support almost 21,000 households directly, and it will indirectly support about 125,000 plus individuals.
In Yobe State, the government says the similarities in the symptoms of COVID-19 and tuberculosis disease has forced many tuberculosis TB patients not to present themselves at health facilities for fear of being diagnosed as COVID-19 patients. The program officer of TB in the state disclosed this at a media training organized for journalists to create more public awareness on the symptoms of the diseases in Damaturu, the state capital.
With the advent of COVID-19 pandemic globally, not only Yobe State or Nigeria, but globally at large, we have huge challenges because there are huge similarities between tuberculosis and COVID-19 presentations. So with many people in the community have fear of being diagnosed with COVID-19, since they will come with the presentation of fever, cough, body weakness and others. So most of them, they have fear to present to the facilities for timely and effective evaluation and also for possible placement on effective treatment for tuberculosis. This is one of the challenge. So the challenge number two is that of which we are working effectively in collaboration with the national program as well as our partners to extend our services across all the existing healthcare facilities in the state. In last year, we made an effort, a tremendous effort by state tuberculosis control program as well as the national tuberculosis program to extend the services. We increased the number of adult facilities from 92 to 183 facilities.
Well, for more on the pandemic trends, Dr. Lara Roberts, a public health physician, joins us via Zoom. Welcome to the program.
Hi, thank you for having me. Good evening.
Good evening. Zero COVID-19 related deaths for more than a week. This is good news, isn't it? And most importantly, how do we maintain this zero deaths with the almost 8,000 active cases that we still have in the country?
It certainly is very good news, and we cannot say that we know totally why that this is so, but we are very, very grateful that it is. We do still need to keep up with the public health interventions of keeping a distance, keeping the numbers that congregate together in closed spaces much lower, keep with the hand washing, hand sanitization, and as much as possible wearing masks in closed public areas. One thing we do have to remember is that as we loosen the public health interventions, we run the risk of increasing the rate of transmission of the virus. And then we start to see an uptick in the number of cases. So far, we want to keep this going, and we can only do that by maintaining our public health interventions.
Are you worried that we're not testing as we should be when you see the recent infection numbers in the last couple of days? And there's also the question of the rapid test kits and who's using it in the country.
Well, we certainly are not testing as much as we should, but the thing is that, as you well know, the PCR test is a very involved and complicated test, and it's also extremely expensive. So to continue using it as a first-line testing method is not actually economically viable at this stage. It is much better that we use the rapid test kits and get them out as fast as we can, particularly to areas where they'll be very useful, travel places, airports and places like that, where people need to be tested so that they can go into an aeroplane or get into a certain venue and things like that. That is something that will certainly continue to make sure our numbers remain low.
Another question also is, our reports today from Yobe, for example, show some people who might mix up symptoms of COVID-19 with other diseases like tuberculosis. I mean, what are some of those common ailments that share similar symptoms with the coronavirus?
Well, tuberculosis is certainly a key one, but even more commonly is malaria. I mean, the symptoms of COVID-19 do very much mimic the symptoms of malaria. And then you've got people who insist that they've got malaria, insist on treating malaria indiscriminately using Artemether combination therapy to treat malaria. And, which then means that they are not quickly getting into the proper care that is needed for COVID-19. Now, it's okay this is not okay at any point, but if they don't develop symptomatic COVID, okay. But if they do, it means that often they're too far away from effective healthcare at the time when they need it, at the time when they start developing breathlessness or dyspnea. And certainly where they're mixing it up with tuberculosis, the issue is that we still have a huge problem with tuberculosis, multi-drug resistant tuberculosis. We're still one of the countries with a high rate of tuberculosis cases that need to be on constant management. So we have to get to encourage more people to come in to make sure that what they have is not COVID or is tuberculosis, so they can get them into treatment.
Finally, before we let you go, do you agree with the WHO DG when he said that the world has the tools to bring the pandemic under control if applied consistently? And if we say one of those tools is vaccination, I mean, look at where we are in Nigeria with vaccines.
Well, certainly I will agree with the DG of WHO. We now have some tools to bring this infection under control. We certainly can drop the rate of transmission with the non-pharmaceutical public health interventions. They are working. We know they work. Every time you loosen those interventions, we get a spike in cases. And we're also running the race, as we say, between infection and injection. We need to get a lot more people vaccinated so we can achieve herd immunity. There's no magic number, but certainly we need to have vaccinated over 70% of the population to be able to say that we're even on the road towards herd immunity. And while we are struggling to achieve that, we need to keep up with the non-pharmaceutical public health interventions. What people don't realize is that the longer we allow the infection to run through human beings, the higher the rate of mutations we get. And the danger is that we then run into some kind of variants and mutations which are now not, if the vaccine is no longer effective against. So we must keep the rate of transmission down using the non-pharmaceutical public health interventions.
We appreciate your time.
And we have it.
Right. Thank you so much, Dr. Lara Roberts, public health physician. Thank you for joining us.
Thank you for having me.
From Nigeria to the Emirates, that has administered nearly 10 million doses of coronavirus vaccines. Here's Marwa Adegoke with more.
Managing the COVID-19 pandemic is changing the way Muslims in the UAE observe the Ramadan fast and celebrate with loved ones.
I used to break my fast with my neighbor, but today my neighbor would send me some food to my house and I will send her some food to her house. So we still have this community aspect of it. I've heard of people who would break their fast over Zoom. My friend, she lives in another emirate and their family lives in this emirate, and she wanted to kind of break her fast with her family. So they just opened Zoom and they booked their fast together. Of course, that is 2021. Everything's over Zoom.
Traditionally, Ramadan celebrations are carried out in large families, groups or communities where Muslims would also gather to pray and break fast together. But that's all changed. Despite having administered nearly 10 million doses of COVID vaccines, people in the country must avoid large gatherings, with suhoor as well as iftar or breaking fast only being limited to people living in the very same household. At the Sheikh Mohammed Center for Cultural Understanding in Dubai, only a handful of tourists are allowed in for a special Ramadan program, which includes educational sessions, iftar, and prayers. A new directive targets restaurants across the city, removing an old law which mandated them to cover off dining areas during fasting hours. This has been lauded by business owners as a progressive solution to help the industry.
It is like keeping a whole economy circle together. Like as the restaurants are open, people are going to dine in. So we are going to purchase vegetables, or dry goods, or everything, and it will keep employees also working more, and it is giving an opportunity to keep the entire circle covered.
Business during Ramadan, it's been slow, but we do have plenty of people coming, inquiring about us. We have just launched an iftar menu as well. So we're trying to cater for both parts of the communities.
Meanwhile, tents which Muslims set up to distribute food for charity have also been prohibited, and for good reason, as the best act of charity in this season is not spreading the virus.
Still to come on the program, health officials around the United States are hitting what appears to be a soft ceiling. We'll tell you more when we return. Welcome back. U.S. President Joe Biden has met his goal to have all adults eligible for the coronavirus vaccine. Health officials around the country are hitting what appears to be a soft ceiling, with more than half the nation's adults getting at least one dose. Dr. David Ajibade is a public health physician, CEO, Brain and Body Foundation. He joins us from Dallas in the U.S. Thank you for joining us on the program.
Thanks for having me, Millicent. How are you?
All right, very well, thank you. I want to begin with how Dallas is today, and this is amidst the news of the sentence handed down, should I say guilty verdict, to Derek Chauvin in Minneapolis, because places like Cleveland, for example, a COVID-19 vaccine mass vaccination site was temporarily suspended. This is out of the abundance of caution following the verdict announcement.
Yeah. I mean, I heard that places in New York too have boarded up. Dallas, to be sure, everywhere in the country, they had people on standby. Of course, the crowds, large crowds outside many of the public areas and the cities and downtown to await the results and the verdict. So, yeah, it was a tense time yesterday for everyone, Dallas included, and I'm glad they made the right decision. In my opinion, that was the right decision.
It's also interesting to see that the trial put the COVID-19 altered courtroom on worldwide display. But let's switch to the U.S. The State Department has announced that it will update its travel guidelines, to more closely align with CDC recommendations. It is saying that approximately 80% of the countries worldwide will now fall under the highest travel advisory level, which is level 4, do not travel.
Yeah, I'm pretty sure. I'm sure many African countries are included in that as well. Here's the thing. There's already a lot of transmission. We're still seeing about 70,000 cases every single day. So yes, the vaccinations have helped tremendously in terms of severity and deaths, but it hasn't really helped by way of the spread. And don't forget, there's a south border crisis where people from all over South America are pouring in through the border. And those who aren't being vaccinated, they are in large groups, so you can be sure COVID-19 is spreading. So yes, it is the right thing to do and to protect the citizens by shutting down on travel to other parts of the world. But don't forget that the roof is leaking, in other words, and it's in the south border. So
as a public health physician, do you think that this would limit transmission if they're sort of closed in, looking at, all of the numbers, all the waves that several other countries, neighboring countries are facing?
I think that ship has sailed. And again, there are many states in the US now who have just basically opened everything up. I go into restaurants. Some of the restaurants, they say you must wear a mask. Other places, they say it's up to you, make up your own mind, whatever you want to do. So even though from a national perspective, they're trying to make sure that CDC regulations are followed in a state-by-state basis, that is not the case in many places. So I'm not sure that's really going to make a difference. Except, of course, when it comes to the variants. So if we're talking about the variant, we're trying to restrict variants coming from outside the country into the US, then that can be a solution to it. But in terms of what is already here, it's already spread too far.
All right. We'd like to thank you for joining us, Dr. David Ajibade, public health physician, CEO, Brain and Body Foundation. Stay safe.
Thank you.
At least 22 people have lost their lives in an Indian hospital after they lost oxygen supply due to a leak. This happened while an oxygen tanker was refilling a storage tank at the Zakir Hussain Hospital in Nashik city. Meanwhile, crematoriums in India are trying to cope with an influx of bodies as deaths from COVID-19 hit a new record today. Meanwhile, over in Germany, the German Chancellor Angela Merkel's national lockdown law has been passed by Parliament. The law forces the country's regions back into tough lockdown once infections exceed a certain level. Let's take a look at the global update.
While the German Chancellor has good intentions regarding keeping number of COVID-19 infections down, the decision did not sit well with all politicians. Some say the measures, such as a nighttime curfew, are too harsh and will undermine support. Outside on the streets, protests have been even angrier. Some demonstrators were far-right activists or conspiracy theorists. Most have refused to wear masks or adhere to distancing rules. So, police ordered the protesters to disperse. France, on the other hand, is expected to lift domestic travel restrictions imposed to tackle the spread of COVID-19 virus on May 3rd. Government spokesperson Gabriel Attal says President Emmanuel Macron's administration was sticking to a base case scenario of bars and restaurants to reopen outdoor seatings in mid-May. The French government has also decided to order COVID-19 tests for travelers coming from India in a bid to prevent the spread of a coronavirus variant. Japanese Prime Minister Yoshihide Suga has cancelled plans to visit India and the Philippines during his country's extended holiday, starting in late April amid a sharp rise in COVID-19 cases. The trip had not been officially announced, but was widely reported in local media. It comes as Japan's government is considering a state of emergency for Tokyo and several other prefectures. Finally, Colombia has announced a daily record for COVID-19 deaths in the country, with 429 people dying and nearly 17,000 cases registered in a period of 24 hours. The South American battalion is battling the third wave of coronavirus infections and has reinstated lockdown and social distancing measures to prevent the virus spread.
Don't forget to protect yourself, continue to take responsibility. You can see more updates, also a better understanding of the pandemic on our website. It has several other stories as well in politics, business and sports. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.